because your uterus is the center of everything in your pelvis, actually her position can significantly impact bowel and bladder function as well as pelvic floor muscle function.
Welcome to Fempower Health. This is Georgie. Today we're diving deep into the world of chronic pelvic pain with Dr. Angie, a doctor of physical therapy specializing in women's health and pelvic health. Dr. Angie has extensive experience working with female athletes and has seen firsthand the common yet often overlooked pelvic issues that many women face. What I found really interesting in this discussion is Dr. Angie started out by applying the typical techniques that she has learned, but still saw people struggling. And so she's broadened her experience and gotten more deep. And I was really blown away with the information that she shared. So in this episode, we explore the structural changes in the body that can lead to chronic pelvic pain, discussing everything from the role of core muscles to the impact of posture and breathing. Dr. Angie explains how the position of your uterus and other pelvic organs can significantly affect bowel, bladder, and overall pelvic floor function. She also shares valuable insights into self-care techniques and non-invasive treatments that can help alleviate pain and improve quality of life. This conversation is crucial for any woman experiencing pelvic discomfort, whether you're an athlete, a mom, or navigating your menopausal journey, or I should say perimenopause and menopausal journey. By listening, you'll gain a deeper understanding of the interconnectedness of your body's structures and learn practical tips for managing and reducing pelvic pain. Now, let's dive into this very important discussion to unlock better pelvic health for you. Dr. Angie, thank you so much for joining me on the Fempower Health podcast. You reached out with some really intriguing topics, and I know chronic pelvic pain is close to my heart. It's one of the topics that people love to talk about on Fempower Health, and so I'm really excited for you to share your expertise. And we haven't talked about this one, which is like the structural changes or the structure of our bodies that can impact chronic pelvic pain and drive it or drive that type of pain. So before we get into it, maybe you can tell us your background and a bit about yourself, and we can dive into this very important topic.
Great. Yeah, thanks for having me. I'm excited to be here. So, I'm a doctor of physical therapy. I got my degree in Denver, Colorado at Regis, and really took a specialty and a real passion in women's health and pelvic health. I started out seeing a lot of female athletes, doing a lot of sports medicine, and just noticing all of these pelvic issues that kept coming up in female athletes, like heaviness and pressure, pelvic pain, hip pain, low back pain, incontinence, prolapse, digestive issues, constipation. And that led me to seek out, further education, further mentorship on these issues. And then after graduation, I really started diving deeper into alternative therapies for this, treating pelvic health and pelvic floor dysfunction. And specifically, chronic pelvic pain is so much more common than I ever thought, coming out of school. And then I think a lot of people realize is that it is incredibly common. And it's common in athletes and non-athletes. It's common in women who've given birth and women who have not. So women preparing for pregnancy, after pregnancy, and then also in post-menopausal and during that menopausal journey, it can be incredibly common as well.
Absolutely. When I first started the Fempower Health podcast, I did a couple of episodes on pelvic health, and it was stemmed because I was at an endometriosis conference, and there were all these pelvic PTs there, and it was an area that was so new to me, and those episodes were incredibly popular. And it's interesting, I'm now in the fifth season of the podcast, And it's still something like it's great. There's a lot more pelvic floor PTs out there. There's a lot more social media about it. But I'm also hearing that those who are not necessarily in the women's health circle, there's still a lot of knowledge to be gained.
Pelvic pain can be very multifactorial, and there can be so many different things causing it. And there's so many different practitioners that treat it. So, gynecologists, urologists, urogynecologists, GI specialists, and everybody sort of has a different view of it. And what I've seen in my experience is even if there is a digestive overlay or something that has to do with the bladder or uterine position, it all really boils down to pressure, pressure in the abdomen and core muscle dysfunction, and how that impacts the position of your uterus. So your uterus is the center of your pelvis and really the center of you as a female biomechanically. So she sits like right in the center of your pelvis. Your bladder's in front of her, your bowel's behind, and the cervix and vaginal vault is directly under her, and she's suspended within your pelvis by ligaments and fascia that go out to the rim of the pelvic bowl, that attach her to the bladder, that attaches to the belly button, that then goes backwards from the uterus to the bowel to the sacrum. There's ligaments that attach the uterus down into the vaginal vault and down into the pelvic floor muscles. And then there's also ligaments that attach the uterus up through the intestines to the spine. There's a ligament called the urachus ligament. This is my favorite one that I do a lot of work with. That actually goes from the head of the uterus all the way up through the chest, behind the heart, splits at the neck, and goes along these diagonal muscles in the neck and attaches to the base of the skull behind the ears. So our posture and how we move our body and our myofascial tension and all of those patterns have such a huge impact on the position of your uterus. And because your uterus is the center of everything in your pelvis, actually her position can significantly impact bowel and bladder function as well as pelvic floor muscle function. So that the position of the uterus and the position of the organs is something that we don't typically look at as a factor when it comes to pain or pelvic floor dysfunction, but in my experience, it's a huge factor. So if the uterus and the other pelvic organs are not in their optimal position, then they don't receive optimal blood flow, lymph flow, nerve flow, and they don't function as well. And so lifting and centering the uterus and optimizing her position can have an incredibly positive effect on chronic pelvic pain, bowel and bladder function, menstrual function, whether you are prenatal, postpartum, or into menopause. So just that hormonal regulation actually has a lot to do with the position of your uterus, because that determines her blood, lymph,
Okay.
and nerve flow, and that then affects hormonal regulation as well.
Well, the way you were just describing the pieces that needed to fit together for optimal pelvic health. I mean, I knew it was complex, but just everything you were listing. I mean, it's also clear that it's not just in the pelvic area that you may have to quote unquote fix. I mean, even when you were talking about, was it the nerves that go in through the neck? Because it was nerves, correct?
The urachus ligament, so the fascia.
Yes. Or the ligaments.
Yes.
Yes. So I guess a question here that I wanted to start with before we continue is pain. It's almost like there's pelvic health, and I know a lot of people say pelvic health is the belly button to the mid thigh area. So it's not just the pelvis itself, but it's that region is what a lot of people describe. But everyone's going to have a different degree of pain. Like, for example, I have endometriosis, and I didn't really have the typical pain symptoms that most women tragically have. So, first, let's talk about this pelvic health and then degree of pain first. And then I think we can dive into some of these structural things that you tend to see so that those listening can at least start to figure out how do they talk to their doctor about what's going on.
So it's like the chicken or the egg. Is your pelvic pain coming from, you know, endometriosis, inflammation, that sort of thing, or is it stemming from pelvic floor muscle dysfunction and pelvic floor muscle
Mhm.
spasm? And it can all feel the same. So sometimes it's hard to kind of dissect out where it's coming from, and oftentimes it's a little bit of everything. So in like a female athlete training for a marathon, or maybe you're just you do a lot of workouts, or you've had a increase in activity lately, so there's been like a change in your activity, or maybe you've been doing more heavy lifting as a mom, like your kid is growing, and or they're getting a little bit more active. So that change in activity could look different in a lot of in various women. So that can be an indication that your core muscles, and when I say the core, I really mean everything except for your arms and legs. So
Okay.
you described, yeah, pelvic health is kind of belly button to thighs. In my perspective, it's really everything except for your arms and legs, because biomechanically all that entire system works together to manage pressure in your abdomen, and it's the chronic repetitive increases in pressure that can cause the uterus to drop, and that can then lead to pelvic floor muscle spasm, and then that can manifest in a variety of different ways. One of them is pelvic pain. So that can feel like, deep, achy, crampy pain in your pelvis, kind of like menstrual pain, or it can just feel like pressure and heaviness in your pelvis. You can have, sharp shooting pains that kind of like come and go, or it can be more constant. So the presentation can be very different in different women.
Now, would women always have some sort of feeling like what you're describing, or could there be, like there's like also, I'm assuming pain with sex and maybe pain in different positions, and maybe it's not even pain; it's like an uncomfort, a level of like, "Ooh, that doesn't feel right." And I think that's something to really distinguish because we women, the one thing so many of the experts and I talk about, especially because we connect with so many women on these topics, is how we women may normalize or dismiss something because we have like people to take care of, and other things to be doing.
Yeah.
And so I think it's so important for us to help women understand what should they be feeling to know that it might be time. Like for me, it was after running that half marathon, I'm like, I think my uterus just moved. I think this is a problem.
Right. Yes. So what did that feel like for you, that your uterus moved? Like, and how did you know it was your uterus?
For me, it's only right when I finished the marathon. I don't know, it just felt right where the uterus would be. I mean, it could be wrong. It may not have been, but that's what it felt like. It felt like an organ moved. I don't know how else to explain it. It just felt uncomfortable, but it was only right after I finished the race, and then I was fine. But it's like right after I'm done is when I feel whatever's going on. But there's been a couple of things in that pelvic region. I'm like, yeah. So it took me about 6 weeks to get an appointment, which is another thing, ladies, to be aware of is experts like you are in demand, and some appointments are like 5 months out.
Right.
And I got very lucky. I found someone who happened to have an appointment 3 months before my marathon. But yeah, anything else as far as like, you've already described some of the feelings, but are there others that women may be experiencing that you want them to be alerted by?
Yeah, so low back pain. Low back pain is a huge one that can indicate pelvic floor dysfunction and, malpositioning of the uterus. And when we talk about pelvic pain, because the uterus and the pelvic floor muscles are so related to the bowel and bladder, other symptoms can just be urinary frequency and urgency, or leaking, or constipation, or diarrhea, or difficulty emptying the bowel and bladder. So all of those symptoms are very much related. Oftentimes, women think that they're separate, like the pain is separate from the bowel and bladder issues, but actually, it's all connected. And the good news is, the really exciting thing is, implementing a protocol to lift and center your uterus and retrain your core muscles to function how they're supposed to function can resolve a variety of issues, especially chronic pelvic pain.
Interesting. So tell me, I guess, a bit about how the structure and like the impacts and treatment kind of work, because you're more the expert on the nuances of this. But and I say this because I know that my knowledge of working with a pelvic floor physical therapist often tends to maybe make women afraid because it could feel invasive. But the way that you're describing it, it seems like there's a lot of potential options for treatment. And by the way, I have been to a pelvic floor PT before, and I will say the grace at which you all handle women's bodies is amazing. And for anyone who may be afraid to go to one, I will say it actually feels less invasive than going to an OBGYN. So if you can get your pap smear, I promise you, you can see a pelvic floor PT. Like I will say it's like night and day.
Yes. Yes.
But yeah, I mean, so maybe you can talk about like how like I guess the structures and treatments and kind of how all that works and how you're figuring it out, because that might even help women describe it so that their clinicians can help the best.
Yes. Okay. I think this discussion kind of starts with just understanding the function of the core muscles. So their primary function is to support your organs and keep your organs in their ideal location in your pelvis, and to support your spine. So when your core muscles are dysfunctional or not doing that, then your organs can get out of their best position and your spine becomes compressed, and that can lead to a variety of pain patterns. So where does that core muscle dysfunction come from? That's kind of like the big question. And it really it can come from suboptimal breathing patterns, poor posture, chronic, an increase in activity where your core muscles are not supporting your organs in the proper way, and that's leading to organ displacement. And so understanding that your core muscles are supposed to keep your organs in their best position for organ function, I think can really help, like, demystify some of that pelvic pain, the fear kind of surrounding pelvic pain, and like the misunderstanding around it before you even go and see your gynecologist, OBGYN, pelvic floor PT. There's a lot of things that you can actually do to help reduce the pain. There's just like little tips, and we can get into that. Just basic understanding of the role of your core muscles, I think is really really helpful in demystifying the sources of your pelvic pain.
And when you're talking about the core muscles, can you just clarify? Because I think when a lot of people think abs and core, they think the six pack. And, we know that it's well beyond that. So can you talk a little bit about what you're meaning by these core
Okay,
muscles?
yes. So your core muscles are your abdominal muscles, your pelvic floor muscles, your spinal muscles, and your diaphragm. So that muscle that sits under your lungs that helps you breathe. Your core muscles are also the muscles surrounding your rib cage. So your intercostal muscles, the muscles of your chest, and the muscles of your shoulder blades. Your core muscles also extend up into your neck, so all the muscles of your neck as well. All of those muscles work together to manage the pressure in your abdomen and your pelvis, and to help you breathe and to help stabilize your spine. So they all work together, and they all have an impact on organ position. So the diaphragm, which is right underneath the lungs, right underneath the rib cage, is works with the pelvic floor muscles. They're like a mirror of each other. So whatever the diaphragm is doing, the pelvic floor muscles are also doing. So anytime you inhale and bring air into your lungs, your diaphragm moves down and your pelvic floor muscles also move down. And so do your pelvic organs. And then every single time you exhale, your diaphragm moves up and your pelvic floor muscles also move up. And your pelvic organs should follow that. But what can happen in core muscle dysfunction is the core muscles can spasm. That's the in 99% of chronic pelvic pain, that is the muscular dysfunction, is muscle spasm, which means those muscles get stuck in a contraction and they can't relax. And so when muscles are stuck in a contraction and they're not able to move through their full range of motion, they don't get as good of blood flow, and inflammation can start to set in. And then that inflammation in turn irritates the nerves, and can cause a variety of manifestations of pelvic pain.
Wow. I mean, this is even broader than what I had known the pelvic floor muscles to contain, like incredibly broad. And so I guess, when you're treating patients, it sounds like the area that you're focusing on is even beyond the belly button to mid thigh.
Absolutely. Yes. Yes. And to kind of circle back to your original question of, seeing a pelvic floor therapist and kind of getting that sort of internal exam, that is where I started. So when I originally came out of school, that's what I learned. Somebody comes to you with chronic pelvic pain, and one of the first things you do is you do an internal assessment of their pelvic floor muscles. And that can absolutely be helpful. And in my experience, what I would continue to find in these patients with chronic pelvic pain was they had pelvic floor muscle spasm. They had trigger points in their pelvic floor muscles. And so you can treat that through manual therapy. So you can release your pelvic floor muscles through internal intravaginal treatment, relieve those trigger points, and that can really help with resolving the symptoms of pelvic pain.
Okay.
However, that does not resolve the root cause of that muscle spasm and the trigger points. The root cause of the muscle spasm and the trigger points is how all of your core muscles function together. So, how the diaphragm and the pelvic floor and the abdominal muscles and the spinal muscles work together in unison to manage pressure in your abdomen and your pelvis and keep your organs in their ideal location. So, what I found through several years of seeing chronic pelvic pain, patients coming into my office, chronic pelvic pain, doing the internal exam, doing the internal treatment, what I started to find is they were becoming like reliant on my internal release of their pelvic floor. And so it wasn't like true healing where it's like, okay, you don't have symptoms anymore and you don't need me. And so that's really where I started to look for alternative ways to help, and to figure out, like, why are these muscles in a spasm in the first place? Like, where is that coming from? You must address the diaphragm, how the diaphragm works, and your breathing. If that's not part of the protocol, part of the treatment protocol, there's not going to be results. There won't be long-term results.
Wow. So, okay, a lot of times, like even when I research chronic pelvic pain, a lot of the things you'll see is, oh, it could be fibroids, it could be endometriosis, maybe it's adenomyosis, maybe it's pelvic congestion syndrome. And so, like, how do those fit in to the type of thing you're describing?
Okay, so everything that you listed, so endometriosis, chronic, yeah, pelvic congestion, adenomyosis. So those are ultimately inflammation. Okay, so where did that inflammation come from in the first place? Yes, it could have a genetic overlying component. You absolutely, it could have an overlying dietary component. So working with somebody who specializes in, diet and nutrition as it relates to hormonal regulation can be very, very helpful. But in all of those cases, the function of your core muscles is ultimately going to determine how much blood, lymph, and nerve flow your uterus, your ovaries, your pelvis receives. And so, that, in my eyes, is the biggest contributing factor to disease in the pelvis and chronic inflammation in the pelvis. And that can be called so many different things. There's so many different diagnoses for that. And you just listed quite a few of them. But all of them are absolutely related to how your core muscles function, how they manage the pressure in your abdomen, how they support your organs. If they're doing that appropriately, then their tone, that's kind of the PT word for whether or not a muscle is like too tight or in its, optimal tone or length to be able to function how it should function. The function of the core muscles is a huge determining factor in your pelvises and your pelvic organs ability to overcome inflammation and to process that and get rid of it.
So, to break it down, if I have this right, I want people to take my general point, not the nuances, into account when I say all this, please. So, with endometriosis patients, you can have someone like me who didn't really have a lot of pain. I just struggled with infertility. Pain with sex in certain positions, but not even pain, just uncomfortable. That's pretty much the only thing I can think of that I had.
Mhm.
Then you have people who will have severe pain, they'll get the surgery, and then they're fine. Then you'll have people who get the surgery and still have pain. Some surgeons will say, "Oh, they didn't get the endometriosis in the deep pockets. That's really where it hurts the most." And then others have said, if you've had the endometriosis a really, really, really long time, then even if you have the best surgeon in the world who gets all of it out, you may still have pain because all that inflammation has been in your body for a very, very, very long time. I'm sure many people disagree with many of the nuances I said. Again, we need clinical trials, so I don't want to debate those specifically, but these are just the range of the types of things I hear from all the experts and patient advocates I've spoken with. So if you were to take all this, am I to understand that, there's kind of this separate decision on, excising your fibroids or excising your endometriosis, but then separately you also have to work through the pelvic floor issues. Is that a good way to look at it? It's not to say, oh, if you just do pelvic PT with the right person, scrap the surgery. That's not what you're saying.
Right. Every case is different. I have had a lot of women who have had a laparoscopic surgery and a true diagnosis of endometriosis. So the gold standard diagnosis of endometriosis is a surgery to see that it's there. I have had a lot of women who have had that diagnosis and have followed the protocol that I teach for self abdominal massage, self pelvic massage, positioning your organs through posture and breathing and various exercises, and have had complete resolution in symptoms. Their fertility returns, they get pregnant, everything is great. And then I have also had women who absolutely do need to have that excised and get a large benefit from, their pain is very much relieved from surgery. And then I've also had women who have, like you said, have had the surgery, but their pain doesn't change. And so retraining their core muscles is ultimately what, you know, heals that pain syndrome. So,
Okay.
in my perspective, all of those different scenarios that you listed, the core muscle function impacts all of them. And so
Okay.
you can't go wrong with retraining your core muscles to function how they were meant to function, because in all of those scenarios, it's absolutely impacting it.
It's just blowing my mind in how many areas it is beneficial to work with a pelvic floor PT.
Yes, yes, it's so multifactorial. Absolutely. So when I'm talking with a patient with chronic pelvic pain, I try to kind of simplify that and break it down into, like two different categories that can impact it. So there's
Okay.
this dietary, behavioral, lifestyle, genetic component that can impact chronic pelvic pain. And then there's
Okay.
also this neuromuscular, biomechanical, anatomical aspect that impacts the chronic pelvic pain. And so when you approach it from both angles simultaneously, that's when I've really seen the best results, taking into consideration, yeah, all of the possible contributing factors. And it's typically not just one.
So how, I guess, just trying to navigate this healthcare system. I mean, you're right. I was talking to Dr. Millhouse, and she's actually, now I'm trying to think, is she a urogynecologist? I know she had multiple different trainings, but even through her, I was learning so many different aspects of all these subspecialists, and, not to divide the healthcare specialists, but, as someone is navigating this, how do they do so? Because even talking to you, not only are you a doctor of physical therapy, but you've had all this other training. What is your best advice on what they need to be monitoring? How do they find the right clinician to eventually get to this path of healing?
Yes, that's a great question. Absolutely. Monitoring what you should be monitoring. I would say monitor your activity level, like any sort of changes in your activity. Monitor, because that is going to impact your muscle function. Monitor your bowel and bladder function. So the frequency of your urination, if there's any leaking, any pain with urination, any difficulty emptying your bladder. Monitor your bowel habits. So constipation, diarrhea. Is your stool, soft but formed? Do you have to push or strain to empty your bladder? um, Bloating, how frequent you have a bowel movement. So monitoring that bowel and bladder function. And then also monitoring your menstrual cycle, um, the regularity, whether there's pain, um, associated at any part of your menstrual cycle, bleeding, ovulation, and also monitoring, the color of the blood too can be a factor that can indicate your uterus is not in her best position. So ideally your period, starts red and ends red. But if there's a lot of clotting, or if the blood is brown, that can indicate your uterus is not in her best position. And there could be other things going on as well. Your diet and your sleep and stress levels. So those are all things that really contribute to the chronic pelvic pain presentation, and you would
Hmm.
want to share with your provider. As far as how to find the right provider, I would say do your own research, really. And I would prefer providers who have a very open mindset to alternative healing, because what I've seen is, like, the typical Western medicine standard of care kind of pathway through that of, prescribing pain medication, or, referring you to all these other specialists, doesn't always get the results. So I would get a pelvic floor PT on board as soon as possible. So asking your
Okay.
gynecologist or primary care provider for a referral to a pelvic floor specialist as soon as possible. I think that that's probably the number one way that you can start navigating the system. And usually, pelvic floor specialists can also help direct you to other alternative treatments.
Okay. That's kind of what I got the sense of, because I do find, like, once you've gotten to the right subspecialist, then they kind of know how to navigate the system.
Yes.
So I got that. Now, you were mentioning, so I love this checklist because honestly, I could imagine going to your doctor and seeing their reaction. And if they're not even trying to listen to you as you're sharing these details about your body, I think that's probably an indication that it's possible to get a second opinion,
Yeah.
so that someone is hearing you. So I would definitely say that. Now, you were saying earlier about how there are certain things people can do at home before they're seeing their clinician. What are some of your thoughts there as far as other ways to be proactive while we're waiting those 5 months to see the specialist?
Um, so right, so being aware of your posture and your breathing can have a huge impact on the position of your uterus and the function and tone of your pelvic floor muscles, and can start to give you relief immediately. So, certain postural things is making sure that, when you're sitting, when you're standing, whatever you're doing, keeping your ears aligned over your shoulders and your shoulders over your hips, and then keeping as much distance between your rib cage and your pelvis as possible. So, I call that keeping your waist long. Okay.
Okay. So the opposite of what everyone's doing when they're staring at their phones on their social media accounts.
Exactly. Exactly. Right. So, that hunched forward posture, that can really cause a downward movement to the organs, and, really worsen pelvic floor muscle spasm and pelvic pain.
Okay.
So posture. So lifting your rib cage up away from your pelvis as much as you can, in the front and the back. So keeping your waist really long, and keeping that optimal alignment. Another thing is, a lot of people think good posture is like squeezing your shoulder blades, like sitting up straight and squeezing your shoulder blades. And that actually restricts the movement of the rib cage, which in turn creates more pressure in the abdomen and pelvis. So, actually expanding your shoulder blades on your back and kind of making the back of your heart a little fuller can be very helpful too. And that then brings me into the importance of breathing. So how you breathe can significantly impact what you're feeling in your pelvis. So breathing in through your nose, so with sealed lips, inhaling through your nose and directing the breath into your rib cage instead of your belly. So a lot of times we're taught, belly breathing in yoga and meditation and relaxation techniques. And it does have a place and a time. So belly breathing will relax your pelvic floor muscles. And that's good to do belly breathing, like when you're lying on your back and gravity is not acting on you. That can be relieving. When you're upright against gravity and, on your computer moving about your day, you want to breathe into your rib cage. And so this is a technique that I teach that's called decompression breathing. So when you breathe into your rib cage and you direct the breath into your lower ribs first and expand them wide, and then allow the breath to rise to the top of the rib cage, and then keep the rib cage open and inflated as you exhale, this has a very lifting effect on the pelvic organs and relieves tension on the pelvic floor muscles. So that type of breathing reduces the pressure in the abdomen and pelvis and can immediately relieve some of those painful symptoms.
Wow. I just started taking singing lessons and I feel like the breathing you're describing, it's the diaphragmatic breathing that they're telling us to do and like really keeping that rib cage open as you're
Yeah.
singing. So I was like practicing it as you're describing it.
Right. Yes, yes. And the diaphragm can move in so many different ways. So, right, with singing lessons, and we're often taught to move the diaphragm down a lot. And so the diaphragm, it's like an umbrella, right, underneath your lungs. And so it can move up into that umbrella shape, or it can become a dinner plate, or it can become a hammock. So it moves through that range of motion. And then it also moves out and in. And so training the diaphragm to bring air into your lungs with more of a lateral movement will relieve pressure in the pelvis, release pelvic floor muscle spasm, and can really help reduce pelvic pain. So training the diaphragm to move in that lateral direction more than the downward direction, in
Right.
my experience, has been the key to relieving that
Okay.
spasm and pain.
Wow. What else? We've got posture, we've got breathing. What else would you I would assume don't do Kegels unless someone's evaluated you, that Kegels are going to help you, not hurt you, right? That would probably be another tip.
Yeah, absolutely. Yeah, Kegels perpetuate pelvic floor muscle spasm. So 99% of people who have chronic pelvic pain or any sort of pelvic floor dysfunction, bowel bladder dysfunction that I listed, menstrual irregularities, um, typically have pelvic floor muscle spasm, which means those muscles are too tight. And so when you do a Kegel, it just makes it tighter and tighter. So actually, what you want to do is relax your pelvic floor muscles and get them back down to their normal, ideal resting tone. And that is done through that decompression breathing that I just described. So, in my opinion, breathing is the new Kegel. Breath work is the best way to
I like
to
that.
really relieve that pelvic floor dysfunction.
Any other exercises or tips as we're trying to navigate this system?
Massaging your own abdomen, looking for tension and trigger points, and trying to soften that, can be incredibly helpful. Doing upward strokes from your pubic bone up to your belly button, and it kind of helps to lift the organs, and relieves that pressure and tension on your pelvic floor muscles. So that can be incredibly helpful too. Self abdominal massage.
I learned to do that, when I was going through my fertility treatments, and I will say, it is such an incredible body awareness thing to do because, in the area where my right ovary is, I was starting to have pain, and I happened to have an OBGYN appointment, and they had to do an ultrasound, and, it turned out it was a cyst. And I was just like, "Oh, whatever, it's fine. I'll just, massage around it instead." And then they saw it was a cyst. Luckily it was able to get rid of itself. But once the cyst went away, I didn't have the pain anymore. And so it was, and it's not something I walked around feeling pain with. It was once I was doing the massage, I'm like, hold on a second, something's not right. So I almost feel like it's just a great body awareness thing to be doing.
Absolutely, it really is. And it's another piece of information that you can give to your provider. You can say, I really noticed I
True.
have tenderness here, and that could lead to maybe further imaging or ultrasounds, and a deeper evaluation of that.
I love talking to experts like yourself and learning so much, and I know this is going to help so many people. How should people stay in touch with you? What would you ask them to do?
Yeah, so you can go to my website. It's www.corerecoverymethod.com. And you can send me an email or a message through my website. And this is the website also that hosts an online program that can take you through my full protocol for optimal pelvic health. And you can learn all the
That's awesome.
techniques I alluded to in this discussion: the posture, the breathing, the self-abdominal massage, self-trigger point release, and the exercises that are really effective for relieving chronic pelvic pain. And specifically, the main exercise modality I use is hypopressive training. And so you can learn a lot more about that on my website as well. And I'm also on Instagram, so you can send me a message on Instagram. It's Core Recovery PT is my Instagram handle. So email or Instagram is a great way
Awesome.
to get a hold of me. And yeah, I love to, just spread the word about this protocol that I've discovered, and get the word out to as many women as possible that healing is absolutely possible, and it doesn't always require medication and surgery. And even if your journey does require medication and surgery, there's a lot you can do to complement that and bring even further healing and just empowerment to yourself. That there's so much that we can do to improve these symptoms. And I think a lot of it starts with knowledge and having these discussions that we had today about all the things that it can be coming from and what we can do to kind of navigate the system.
Truly, thank you so much for, really digging deep into how best to help your patients based on the things that you've seen throughout your career. And I really appreciate you making time today. So I can't wait to share this with the audience.
Yes, thanks for having me.
And that wraps up another empowering session here at the Fempower Health Podcast. Now, before you dash off, I've got a quick, exciting invitation for you. Please join our vibrant community by subscribing to our weekly newsletter, because it's really your frontline update on groundbreaking women's health research, the latest health-enhancing products, fun quizzes to boost your health IQ, and unique discoveries that you won't want to miss. All of this delivered straight to your inbox, cutting through the noise of social media algorithms. Love today's insights? Show your support by rating and reviewing our podcast. Your feedback is more than just a pat on our backs here at Fempower Health. It lights the way for others seeking guidance and community in their health journey, amplifying the voices that need to be heard. And for a deeper dive into today's topics, check out the show notes and explore our website at fempower-health.com. Our site is a treasure trove of knowledge, neatly categorized by topics of interest and life stages, ensuring you find exactly what you need to empower your health journey. And your voice matters to us deeply. Whether you have a question, a story to share, or feedback on our episodes, reach out directly at info@fempower-health.com. Drop us a message on social media or hit reply on any newsletter. Your insights inspire our conversations. And a quick note, the knowledge we share is here to embolden you in discussions with your healthcare provider. It's not medical advice. Always consult with your doctor for health decisions. And remember, the diverse perspectives of our guests reflect their individual journeys, and it's not an endorsement by Fempower Health. Here's to empowering your health journey one episode at a time, and I'll see you on the next Fempower Health Podcast episode.